It's really my great pleasure to introduce today three outstanding world-class scientists, leaders, inspirational women who are accomplished in their own disciplines. Dr. Maliha Al Hashmi is Senior Advisory role at KSA Entities. Will be talking about the role of AI and digital technology in the ever-changing landscape of health and well-being. And she's going to be giving this umbrella talk where basically, data science, not only from medical records or medically related data sources, but from everything in our environment can be combined to improve health. Marinka Zitnik is a colleague at the Harvard Medical School who's going to look at trustworthy and actionable AI in medicine, specifically as it applies to some biotechnology and development of medicines. And last but not least, Nadine Haram, co-founder of Breximi, is going to tell us about the future is now and look at intelligent operating groups. So I really look forward to a fantastic panel and discussions. And I think all these women are going to show us is how we can use the skills and the power of data science so that our patients and our population may have life and have it more abundantly. I'm going to move on now to introduce our first speaker. Her presentation, fortunately, had to be taped because of commitment for government responsibility. This is our keynote speaker, Dr. Maliha Al Hashmi. Dr. Maliha Al Hashmi received her doctorate and master's degree from Harvard and Massachusetts Institute of Technology. She's listed as one of the top 20 women in the nation of the United States of America and the top 7 most talented female health leaders in the MENA region. She has committed herself to bringing positive change, wellness, and growth to the Kingdom of Saudi Arabia. She served as the executive director and co-head of the health, well-being, and biotech sector at NEOM in Saudi Arabia, where she served as executive director for strategic partnerships. And Dr. Hashmi also served as the deputy chair for the NEOM COVID Leadership Task Force. So without further ado, she's going to tell us about AI for good, positive impact of digital tech on health in general, and merging it all. So can we please play the tape for Dr. Al Hashmi?
Hani, the volume is not working. Apologies, ladies and gentlemen. We will work on fixing the audio. And we will play it again for you.
Bismillahirrahmanirrahim. Marhaba, assalamu alaikum, and hello everyone. It's a pleasure to be here today talking to you all about a very, very close subject to my heart and something that's very important about the ever-evolving, ever-changing landscape of the healthcare arena. What's happening with it? How can we humanize technology to support it? And most of all, what is happening with human health? Let me start with the basics and walk you through the journey. So despite advances in health, life expectancy has not increased over the past 6 years due to physical inactivity, mental diseases, drug abuse, and chronic diseases. What's more is the burden of chronic diseases such as diabetes is ever increasing at such alarming rates across the world that just imagine that 20% of the population of the GCC region is diabetic. What's more is physical inactivity has led to 5 million deaths in 2016, and by 2050 we will see a reduction of life expectancy by 3 years. We need to get more effective and sustainable in our health systems. We need to bring in technology as well. But there's good news. The future is faster than you think, and the future is now. And here in Saudi Arabia, we are taking health back into our hands, and so is the rest of the world. And what's important is that we want to take health in a very different level, is how do we design health, well-being, biotech ecosystems with technology, with AI that has never been imagined and designed before, that's completely comprehensive, that's integrated, and starting from the beginning with an AI-supported system to make it sustainable. So let me tell you how it works and how technology plays a role. The starting point of every healthcare systems in the world is healing the sick. Well, the real starting point, which is overlooked many times, is really from cradle to grave. And we have to shift the paradigm of care by investing in healthy people and focusing on redesigning a system that focuses on proactive prevention, personalized preventative care to create a fully integrated system. And when we think about artificial intelligence, some of the first things that come to mind is power. Well, power will come, but how will we make AI accessible to all citizens to keep them healthy? We will use AI to empower citizens in making them more self-aware and more in control about their own health. So to develop a person-centric, AI-driven model to create a system of care that's personalized, preventative, and enabled through AI. So the power that I talk about AI is empowering citizens around the world. I don't call them patients, I call them person-centric systems in a journey of care where they're empowered by AI and digital technology to be more in control of their health and more self-aware and more empowered by the uses of technology, humanizing it for the benefit of humankind. So real-time assessments, digital technology, personal health promotion plans, and behavioral health change plans all are part of this, right? This will be complemented by smart Internet of Things, technologies such as wearables, smart mirrors, connected appliances, and many more to generate behavioral insights. So all the data will be collected and utilized to generate digital twins for citizens to empower AI-driven analytics to forecast risk factors and to assess the impact of treatment and behavioral change to help drive this personalized health promotion treatment, which is all part of the theme of proactive prevention. Really, it's about how do we use technology is really what matters. So we can use technology for good, and indeed AI can be used for good, and such a good that can prevent future diseases and disasters from happening. While developments in humanizing technology and using AI for the purpose of giving back to society has become prevalent in the recent years, which is more than ever before and very consoling for my heart. And so when we think of artificial intelligence, when we think of empowerment, we think of empowering naturally the citizens to give them more self-control, self-agency, and self-awareness. Recent technological advancements have led to dramatic increases in life expectancy. I was just talking to you about life expectancy and how it had been delayed because of very much public health matters. Well, AI can help us in that. And over the last decade, what we've seen is leveraging AI potentially game-changing in the areas of population health, biomedical research, and personalized preventative care will continue this trend of healthier, longer living populations. So let's start. So first and foremost, AI can improve overall population health with more accurate disease transmission models that increase prevention through identification of early warning signs. Well, we saw this in COVID, right? We were struck by the COVID pandemic for the past 2 years, still, in the midst of it, but more on the end of coming out of it, thankfully. But multiple institutions have been using AI to model and, the spread of COVID-19 to predict and prevent an effective, chart of where it's being differently transmitted across the world and to produce patient risk scores. This data has helped and continues to help governments, officials enact policies that reduce transmission, prepares the hospitals, and prepares the doctors to identify the patients which need to be on a ventilator. Well, beyond modeling, AI can actually realize real-world data to find previously unseen symptoms and identify early warning signs for both communicable and non-communicable diseases. During a recent study at MIT, Researchers used machine learning to analyze cell phone recordings of participants' coughs, where they were able to identify 100% of asymptomatic COVID-19 cases. So widely distributing this technology could have larger public health implications, reducing unintended spread through asymptomatic carriers, interacting with friends or family or co-workers. Similar applications of AI are being used elsewhere to improve non-communicable diseases and predictions. Indiana University recently analyzed the epidemiological risk factors to develop a system that can predict new risk factors for childhood obesity with 85% accuracy, which is amazing. Likewise, other networks of hospitals, including Microsoft's AI network, has partnered to predict cardiac diseases among the general population through a machine learning model to identify the commonalities of patients scaled globally. So these two technologies alone can help prevent 17.9 million cardiovascular diseases and 1.6 million diabetes deaths per year. That's amazing. So the impact of AI and technology is huge in the healthcare arena and can really serve societies to a different level. Another interesting element is AI is also turbo-changing biomedical research and discovery in the long and costly process of pharmaceutical research and development and approval. So Moderna, for example, recently used AI and other digital technologies to drive a rapid pace of learning to enable coworkers and workflows to draw insights from vast amounts of data to create the COVID-19 vaccine in 11 months, a process that typically takes 10 years. It was technology and AI that made it possible. Thankfully, we're all vaccinated because of that. And by further developing applications of AI to streamline pharmaceutical industry and trials, both time to market and cost can cut the wait time and the production time to a level that we're able to have this, immediate therapeutic, solutions immediately without having to have that wait. There's a program called AlphaFold from Google's DeepMind that revolutionized the field of biology by using deep learning to accurately, predict and determine the 3D shapes of proteins involving a 50-year-old grand challenge. The AlphaFold method actually has become humanizing, has many humanizing applications, including development of groundbreaking treatments that decrease or eliminate aging cells that cause cellular dysfunction and tissue damage. So again, leveraging AI applications in other areas of biomedical research could also lead to pioneering vaccines that target non-communicable diseases like heart disease, like diabetes, allowing individuals to take back their lives from these diseases. So we will add, years of life through the use of AI and digital technology. And finally, AI is used in personalized, proactive, and preventative healthcare, which is a game changer. So you see in mobile devices, health-focused wearables, where individuals put them in charge use them, and it gives individuals to be in charge of their well-being, to encourage healthy behavior, and puts everyone sort of self-aware about what's going on with them. So by combining advanced sensors, device data, health records, and AI algorithms to accurately identify patterns and needs of patients, healthcare professionals are empowered to provide the tailored, advice on exercise, nutrition, behavioral change to support the patient or person's self-awareness of healthy living. Well, these small changes to healthy living may seem trivial to some, but research conducted by Harvard found that supporting healthy living habits can increase lifespan by as much as 14 years in females and 12 years for men. Again, which is huge. Other solutions of AI is the AI-powered mobile system assessment, easily accessible, early diagnostics, and early, efficient allocation of medical resources. So you have chatbot technology, AI analysis, which can deliver personalized diagnostics for clinicians to quickly diagnose the problem, develop a personalized treatment, and track the effectiveness of care. Sometimes all that is needed is the timing and how quick can you address a problem. With AI, that can be solved. And all these technologies are the tip of the iceberg for the good that can be achieved by AI in helping healthcare systems. While designing and implementing AI solutions into existing healthcare systems might be challenging, it's happening one step at a time. And AI's demonstrated impacts on health and well-being to date highlight the need to foster innovation and adoption. A concerted effort from AI innovators, health providers, individuals, and policymakers will be required to create a fully AI-enabled healthcare sector that's safe, sustainable, and equally empowering for humanity to live longer and healthier lives. On that note, I will leave you to the discussion of the other two speakers who will go into some details of how AI can be helpful in specific areas of health. And with that, again, empowerment and power can be used in a very beautiful and positive way. For AI, if we use it for health, we're empowering individuals to overcome their self-awareness, to overcome their insecurities, and to become empowered, powerful citizens who are powered by their health and healthy and happy living. Thank you. On that note, I'll give it to the other speakers. Thank you. Bye-bye.
Thank you. Unfortunately, Dr. Maliha could not be with us in person.